Right, so the CEO of an American healthcare company was assassinated yesterday, and the way he's been treating people, it's a surprise it didn't happen sooner. Apparently, he made a lot of money just scamming people, denying healthcare, and the reaction, of course, has been less than sympathetic, as you'd expect. Anyway, new clues emerge as investigators hunt for the gunman who killed UnitedHealthcare's CEO. This is AP News, by the way. So, anyway, new clues emerged Thursday, that's yesterday, in the hunt for the masked gunman who stalked and killed UnitedHealthcare CEO Brian Thompson, including possible leads about his travel before the shooting and a message scrawled on ammunition found at the crime scene. The words deny, defend, and depose were found emblazoned on the ammunition, echoing a phrase used by insurance industry critics to law enforcement officials said Thursday. Yeah. The words were written in permanent marker, according to one of the two officials, who were not authorised to publicly discuss details of the investigation and spoke to the Associated Press on condition of anonymity. Investigators also now believe the suspect may have travelled to New York last month on a bus that originated in Atlanta. One of the law enforcement officials said it was a long distance from there to New York. I'm guessing a Greyhound one. yeah. Anyway, police and federal agents have been collecting information from Greyhound in an attempt to identify the suspect and are working to determine whether he purchased the ticket to New York in late November, the official said. Excuse me. Police also released new photos Thursday of a person wanted for questioning in connection with Thompson's killing. The images show an unmasked man smiling in the lobby of a Manhattan hostel, add to a collection of photos and video that have circulated since the shooting, including footage of the attack itself, as well as still frames of the suspected gunman stopping at a Starbucks beforehand. Yeah, what to know? What happened? UnitedHealthcare CEO Brian Thompson died in a dawn ambush Wednesday. Yes, it was 2 days ago, as he walked to the company's annual investor conference in New York. Who he was, chief executive of UnitedHealthcare, and kept a relatively low profile. Yeah, of course. Officials say shooter is still at large, appears to be a man who is wearing a black face mask and black and white sneakers. Thompson, the head of one of the largest US health insurance, died in a dawn ambush Wednesday as he walked from his Midtown hotel to the company's annual investor conference at a Hilton across the street. The reason for the killing remained unknown. I think it's obvious why they killed him, because he's a complete bastard who scammed people. But New York City police say evidence firmly points to it being a targeted attack. Of course it was. The messages on the 9mm ammunition found at the scene of the shooting mimic the phrase delay, deny, and defend, which is commonly used by lawyers and insurance industry critics to describe tactics used to avoid paying claims. It refers to insurers delaying payment, denying a claim, and then defending their actions. Yeah, of course they defend it because they're complete bastards. Like the DWP. Health insurers like UnitedHealthcare have become frequent targets of criticism from doctors and patients for denying claims or complicating access to care. Yep. In America, you get medical debts and what have you. The only country to do so, and we need to get rid of this. So this is a surprise it didn't happen sooner. America needs to fight back. Do it more often now. It's gone on long enough. Investigators also recovered a cell phone from a pedestrian plaza through which the shooter fled. Inside a nearby trash can, they found a water bottle and protein bar wrapper that they say the gunman purchased from Starbucks minutes before the shooting. The city's crime lab is examining those items for DNA and fingerprints. Investigators were still trying to obtain additional information from the phone Thursday, law enforcement officials said. A tip that the shooter may have stayed at the hostel said, brought police. Sorry. A tip that the shooter may have said stayed at the hostel brought police Thursday morning to at least 2 such establishments on Manhattan's Upper West Side, according to one of the law enforcement officials briefed on the investigation. The photos made public Thursday were taken in the lobby of a HI New York City hostel. Okay, is it HI or just he or what? Whatever that means. We are fully cooperating with the NYPD, and this is an active investigation. Cannot comment at this time, hostel spokesman Danielle Brumfitt said in an email statement. Investigators believe the suspect used a fake New Jersey identification card when he checked in the hostel, said one of the officials who spoke with the AP. Excuse me. Employees who work at the hospital told investigators they remembered a man who almost always wore a mask when interacting with them or passing by the front desk, okay? That person wore a jacket that looked like the one worn by the man pictured in surveillance images released after the shooting, the official said. After the shooting, police said the gunman fled on a bicycle and was last seen riding into Central Park. Members of the public have flooded police with tips, many unfounded. Police searched a Long Island Railroad train Wednesday night after a commuter claimed to have spotted the shooter, but they found no sign of a gunman. We're following up on every single tip that comes in, said Assistant Commissioner Carlo Nieves, a police spokesperson. That little piece of information could be the missing piece of the puzzle that ties everything together. Based on surveillance video and evidence from the scene, investigators believe the shooter had at least some firearms training and experience with guns, and told the weapon was equipped with a silencer. One of the law enforcement officials told the AP, and they've been hearing that it could be a professional hitter's done. So he knows what he was doing. Investigators were also looking into whether the suspect had pre-positioned the bike as part of an escape plan, the official said. Security video shows the killer approaching Thompson from behind, leveling his pistol and firing several shots, barely pausing to clear a gun jam when the executive tumbled to the sidewalk. Cameras showed him fleeing the block across a pedestrian plaza before getting on a bicycle. Police released several images of a man wearing a hooded jacket and a mask that concealed most of his face, a look that would not have attracted attention on a chilly morning. Thompson, a father of 2 sons who lived in a Minneapolis suburb, had been with Minnetonka, Minnesota-based UnitedHealthcare since 2004, 20 years, and served as CEO for more than 3 years. His wife Paulette told NBC News on Wednesday that there were some people that had been threatening him. Well, what do you expect? She didn't have details, but suggested the threats may have involved issues with insurance coverage and debts and people being denied healthcare and what have you. The insurance parent company, UnitedHealth Group Incorporated, was holding its annual meeting in New York to update investors on its direction and expectations for the coming year. The company ended the conference after Thompson's death. And the question is, who's going to replace him? Is it going to be someone just as bad or worse? Probably. UnitedHealthcare provides coverage for more than 49 million Americans and brought in more than $281 billion fucking out in revenue last year. It's a lot. It is the largest provider of Medicare Advantage plans in the US. and manages health insurance coverage for employers and state and federally funded Medicaid programs. Ready? In October, UnitedHealthcare was named, along with Humana and CVS, in a Senate report detailing how its denial rate for prior authorizations for some Medicare Advantage patients has surged in recent years. Yeah. So yeah. So the CEO, that Brian Thompson, yeah, he's been killed, and yeah, from what I'm hearing, he's denied so many people much needed care. So it's just a surprise this didn't happen sooner. And to the healthcare system in general in America, what needs to be fought back. Now's the time. It's long overdue. Yep, so there you go.